Ivosidenib tablet is used to treat certain types of blood cell cancer, such as acute myeloid leukemia, AML, and myelodysplastic syndromes, MDS. It helps your bone marrow grow normal blood cells, reducing the need for blood transfusions. Ivosidenib is also used to treat bile duct cancer by slowing the growth of cancer cells. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. Before you start taking ivosidenib, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. It's important not to take this medication with a high-fat meal and to swallow the tablets whole. The dosage will depend on your medical condition, response to treatment, and other medications you may be taking, so make sure to tell your doctor and pharmacist about all the products you use. To get the most benefit from this medication, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. If you vomit after taking a dose, do not take another dose and wait until the next day to take your next dose. Some common side effects of ivosidenib tablet include diarrhea, nausea, vomiting, stomach/abdominal pain, constipation, mouth sores, decreased appetite, dizziness, lightheadedness, headache, or tiredness. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, rise slowly from a sitting or lying position. This medication has been prescribed because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, tell your doctor right away if you experience numb/tingling skin, muscle/joint pain, fast/irregular heartbeat, severe dizziness, fainting, signs of kidney problems, or symptoms of tumor lysis syndrome such as low back/side pain or muscle spasms/weakness. Ivosidenib can cause a rash, which is usually not serious but may be a sign of a severe reaction. If you develop any rash, seek medical help immediately. A serious allergic reaction to this drug is rare, but if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Remember to follow your doctor's advice and take this medication at the recommended daily dosage and at the optimal timing. If you are taking ivosidenib tablet, it's important to be aware that it can rarely cause a serious condition called differentiation syndrome in patients with acute myeloid leukemia, AML, and myelodysplastic syndromes, MDS. This condition can be fatal, so it's crucial to seek medical help immediately if you experience symptoms such as fever, cough, shortness of breath, chest pain, rapid weight gain, or swelling of arms/legs. It's important to follow your doctor's instructions closely and report any concerning symptoms right away. Remember to take your medication as prescribed and at the optimal timing recommended by your doctor. Before taking ivosidenib, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist before using ivosidenib. Ivosidenib may affect the rhythm of your heart, causing a condition called QT prolongation, which can lead to serious symptoms that require immediate medical attention. The risk of QT prolongation may be higher if you have certain medical conditions or if you are taking other drugs that can cause this condition. Be sure to inform your doctor of all the medications you are taking and any heart-related conditions you may have. Low levels of potassium or magnesium in your blood can also increase the risk of QT prolongation. This risk may be higher if you are using certain medications or if you have conditions such as severe sweating, diarrhea, or vomiting. Talk to your doctor about using ivosidenib safely. Ivosidenib may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness, such as driving or operating machinery, until you can do so safely. Limit alcoholic beverages and discuss marijuana use with your doctor. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or planning to become pregnant, do not use ivosidenib as it may harm an unborn baby. It's important to use reliable forms of birth control while using this medication. If you become pregnant, talk to your doctor about the risks and benefits of using Ivosidenib. It is unknown if Ivosidenib passes into breast milk, so breastfeeding is not recommended while using this medication and for 1 month after the last dose. Be sure to consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect how Ivosidenib tablet works in your body. This includes medications that may speed up the removal of Ivosidenib, as well as medications that Ivosidenib may affect the removal of from your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. For example, medications such as rifamycins, St. John's wort, and drugs used to treat seizures can affect how Ivosidenib works. Additionally, Ivosidenib can speed up the removal of other medications from your body, which may affect how they work. It's also important to note that Ivosidenib may decrease the effectiveness of hormonal birth control, so it's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while using this medication. It's also important to be aware that many drugs besides Ivosidenib may affect the heart rhythm, so it's important to discuss any concerns with your doctor. Always follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much Ivosidenib and is experiencing severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. In Canada, residents can contact their provincial poison control center. It's important not to share Ivosidenib tablet with others. Before starting this medication and while taking it, make sure to undergo lab tests like complete blood counts, blood mineral levels, ECG, liver/kidney function. Remember to keep all medical and lab appointments. If a dose is missed, take it as soon as you remember. If it is within 12 hours of the next dose, skip the missed dose and take the next dose at the regular time. Do not double the dose to catch up. When storing Ivosidenib tablet, it's important to keep it at room temperature, away from light and moisture. Be sure to keep the drying agent, desiccant, in the bottle, and avoid storing it in the bathroom. It's crucial to keep all medications away from children and pets. When it comes to disposing of Ivosidenib tablet, never flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on safe disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.